Marshall. Uh, okay. Yeah. Now the recording is on. Okay. Good afternoon. Regina and I'll be your guest speakers today. We'll be sharing some great information today. We'll be talking a little bit about the Appalachian region and preventing type 2 diabetes in our poor rural communities. Uh, so if you guys will just mute your phones, computers, and we'll open it up for questions anywhere. But if you have questions, just go ahead and put them in the chat box too. And we'll try to monitor that as well if you'd rather not raise your hand or something like that. So I guess we'll go ahead and get started. I think everybody knows us, Regina, so we won't have to really do too big of introductions, but we both work for Marshall University Center for Rural Health, and we are happy to be here today. Our objectives today, we hope to accomplish by providing an overview of how type 2 diabetes disproportionately impacts our Appalachian communities. We'll provide just a brief overview of the National Diabetes Prevention Program, and then we'll move into providing an overview of the Umbrella Hub organization, which we have been fortunate enough to be a part of now for going on 4 years, I think, something like that. Almost 5, almost our 5th year anniversary. And then we'll share some great benefits and opportunities for folks who are interested in joining our Marshall UHO. So we'll move right along. The Appalachian region is characterized by steep mountains and narrow valleys. I know everybody on this call right now can relate to that. In fact, I think those are right out my back door, some of these mountains right here. The Appalachian region is approximately 205,000 square miles along the Appalachian Mountains. And some of you all may or may not know this, stretching from New York to northern Mississippi. Appalachian counties are home to more than 25 million people. Residents in distressed counties, as you know, have a higher risk of diabetes and other chronic diseases for various factors. And we'll move into some of that here in just a little bit. Okay. And most of you are familiar with some of these pictures, you know, our faith and hunting and people making apple butter, and music is a big part of our heritage. But there are many health disparities in Appalachia. Many people face serious health challenges because of conditions where we live, and you guys know that all too well. Health disparities are worse in Appalachian counties with the highest unemployment and poverty rates compared to the rest of the nation. People in Appalachia have significantly less access to health care. They also have higher rates of substance use and mental health disorders, higher rates of cancer, and other chronic conditions. In 2010, there was a study done, and researchers found that residents in 78 Appalachian counties classified as distressed, and they were 1.4 times likely to have diabetes than residents of non-Appalachian counties. And you folks, the ones that I see that are on the call, are in those poorest of poor counties, and the Appalachian region really kind of identifies those communities, those that are higher risk. We know that there are health disparities all across Appalachian region, but in our counties in particularly are even more at risk. Next slide, Regina. Okay. So what does health disparities mean? The CDC defines it, health disparities as preventable differences in burdens of disease, injury, violence, or in opportunities to achieve optimal health experienced by socially disadvantaged racial, ethnic, and other population groups and communities. Go ahead, Regina. Next slide. Can you back up? Hot minute. There we go. So who's affected by health disparities? Multiple groups. This can occur based on your racial or ethnic group, your religion, socioeconomic status, which is one of the big things that the Appalachian Regional Commission measures, okay, with those poorest of poor counties. So there are lots of things that, and lots of people of different race, gender, age, mental health, all of that can be affected by the health disparities across our Appalachian region. Okay. There are lots of factors contributing to health disparities, and the one that we'll kind of focus more so on today will be the social determinants of health. And many of you probably are very familiar with that, but there are a lot of contributing factors to the health disparities that we experience. Social and community context, healthcare access, neighborhood and built environment, workplace conditions, our education, our income, and wealth gaps. And we all know that poverty also affects these health disparities. Okay. So I've got a little video. I think it will explain the social determinants of health, and it's very well related. I hope it, do you hear it, Regina?
Let me enable the I may have to stop sharing for a minute. I have to share my sound.
Oh, okay.
Sorry about that. Share sound, video clip. Got it. Okay, ready?
Yes.
This should work.
I should really go to the doctor, but the closest office is an hour away. I can't take that much time off work.
Since I got laid off last month, I felt so stressed. I need to provide for my kids, but no one is hiring. I don't know what to do.
I used to know every single person that lived on my block. Now I don't even recognize the place. There's just no sense of community anymore.
When we talk about how to maintain our mental and physical health, we often focus on things like eating healthy and going to the doctor. But our health isn't just affected by the choices we make. It's impacted by our environment. The conditions in which people are born, grow, work, play, learn, and worship are called social determinants of health. Social determinants of health can be visualized as a river with two categories of determinants: upstream factors and downstream factors. Upstream factors occur at the systemic level. Examples include institutional discrimination and accessibility of education, employment, housing, healthy foods, and quality health care. Downstream factors are specific to individuals. Examples include employment status, level of education, and aspects of identity such as gender, race, and disability status. Just as building a dam upstream impacts the flow of a river downstream, upstream social determinants directly affect downstream ones. Consider race. In and of itself, race does not impact health. Rather, systemic racism leads to consequences like less access to employment and education, which in turn negatively impact health. To begin to recognize the relationship between social factors and health, consider these statistics. Suicide rates are highest in the Western American states and in Appalachian regions. Non-Hispanic Black individuals have the shortest life expectancy of any racial group, and the mortality rate of Black infants is more than double that of white infants. And as compared to people with an annual family income of $100,000 or higher, people with a family income of $35,000 or lower are 5.4 times more likely to experience serious psychological distress, but 10.6 times more likely to go without needed care due to cost. Tackling the social determinants of health, especially the upstream factors, can seem like a huge task, but we can all make a difference by advocating for change in our own communities. A good place to start is with the U.S. Healthy People website. This site has stated goals related to social determinants, which are aimed at improving the following. 1. Access to jobs, food, and housing. 2. Access to education. 3. Community connectedness and inclusion. 4. Access to health care and health literacy. And 5. Neighborhood safety and housing quality. Throughout this process, remember that systemic issues impact individuals differently, that people are the experts of their own lives, and that social structures won't change overnight. But with empathy and sustained effort, we can better the health of everyone.
I love that video. I like the fact that it talks about not only the social determinants of health, but you as community-based organizations have an opportunity of going upstream and preventing a lot of chronic conditions in your own communities. And that's the beauty of what we'll be talking about in the latter half of our presentation today. But, you know, prevention is really the key. And so we'll move into talking a little bit about diabetes. We know that type 2 diabetes it's a monster in itself. And in Appalachia, we just, in Urals counties, the prevalence of diabetes has just skyrocketed. And in fact, I got an email yesterday that was talking about that type 2 diabetes has increased even more so over the last several years. And so, you know, that's why I want you guys just to keep in mind that diabetes is a preventable disease. It's certainly, especially with the interventions that community-based organizations can do to help prevent that, whether it's physical activity programs, healthy eating programs, self-management programs. There's all kinds of things that we can do to really help prevent type 2 diabetes. And in a nutshell, this is when the cells don't respond normally to insulin and the glucose gets trapped in our blood. And there's tons and tons and tons of complications. And I don't think I have to go over how all of those complications are, because we deal with them day to day in our communities. But most often, type 2 diabetes is just because of a poor lifestyle habits that we've developed over time. And we know in Appalachia, we have a lot, we have a lot of barriers. We have mountains. We don't necessarily have streets we can walk. Grocery stores in poor distressed counties we don't have access to those in some of our counties that I'm well aware of, or you have to travel at least a half hour or an hour to get to a grocery store. And fresh fruits and vegetables are not always easily accessible. And so there are lots of barriers. But again, think of that as being upstream, and diabetes as being something that we can definitely catch before it comes downstream. Okay, next slide. More than 38 million Americans have diabetes. That's about 1 in 10. And about 90 to 95% of them have type 2 diabetes. Okay. And Regina, I'll let you talk about pre-diabetes.
Thank you so much, Sheila. In this next section of the information session, we'll talk a little bit about pre-diabetes. We'll talk about the National Diabetes Prevention Program, and then we'll talk about the benefits of joining the Marshall Umbrella Hub organization. So pre-diabetes, so Sheila gave a very good explanation of what type 2 diabetes is. So pre-diabetes is when your glucose levels are not high enough to be diagnosed with type 2 diabetes, but they're not exactly normal. So you're in this kind of middle window where if you keep continuing your current lifestyle habits, eventually you will go on to develop type 2 diabetes. So pre-diabetes is that before you actually develop type 2 diabetes, but you actually don't have normal glucose levels. And there are more than 1 in 3 adults have pre-diabetes. 9 out of 10 don't even know it. So just think about that. 90% of people who have pre-diabetes don't even know it. And that could be for various factors. For example, Sheila talked about not having access to healthcare. If you're not going to a doctor regularly, you're not getting your glucose checked, you don't know, what chronic diseases you do have, but that puts you at greater risk for developing type 2 diabetes and other chronic conditions that could impact your health or lead to early death. So preventing type 2 diabetes is very important. So just think about that example of upstream. So prevention, an ounce of prevention is worth a pound of cure. I always remember that from somebody that I don't,
Yes.
I don't know who said that, but that's what we always say in public health. So you want to focus on prevention, so you don't have to worry about a cure because you never develop it. So the National Diabetes Prevention Program is a program that's developed by the CDC, the Centers for Disease Control and Prevention in Atlanta. So this program has been around for at least 10 years, I know. At least 10 years. There's been a lot of research on it. At first, a study was first conducted with the YMCA to test this model and its effectiveness, and it's been revamped. They have all these type of marketing materials based on different populations that you may serve that you can customize to promote this program. This program is actually focused on 2 major things, on nutrition and increasing physical activity. So we know if you improve your nutrition and you increase your physical activity, you're more likely to lose weight. So the performance measures for this program focuses on helping people reduce their weight, which impacts the likelihood that you would develop type 2 diabetes. It's a 1-year program. I know when people hear that, like, that's a long time. And well, it is, because you think about behavior change, it takes a while to change behaviors. So through the classes that are facilitated by a lifestyle coach that's trained in the CDC curriculum, you will discuss different topics that revolve around how you can increase or improve your nutrition, how you can increase your physical activity, and you develop your own goals. And the lifestyle coach helps facilitate discussion to help you figure out how you can reach your goals. So it's not a prescriptive program, but it provides like basic knowledge around proven strategies to help you change your behavior. So it focuses totally on behavior change, and you develop your own goals and how you want to reach them with the assistance of the lifestyle coach in the group in itself. So it's peer support. You're having discussions, people share what has been successful for them. It may or may not be successful for you, and you can share your experiences. So it's the support of the group and the lifestyle coach that's been most effective. In the CDC curriculum, there are handouts, there are lessons, there are resources about how to make healthy changes. I already talked about the lifestyle coach, and then the strength of the support group. So the other people in the class that can help provide suggestions, recommendations. I'm also a lifestyle coach for this particular program, and I can just think back to people sharing their stories about why they wanted to participate in this program. So it's 12 months. So you have to think about what's your motivation for enrolling, and then what makes you stay in this program? Why do you want to prevent type 2 diabetes? Most of the time people share stories about, they have a grandmother or maybe their mother or father had type 2 diabetes, and they, unfortunately passed away due to complications, and they didn't want that to be them. So they wanted to lead healthier, longer lives for their children and their grandchildren. So they kind of wanted to stop the generational habits of unhealthiness and develop new ones so they can share with their families how to live more healthier lifestyles. So through the 12-month program, some of the core strategies or key concepts are adopting healthier habits, how to prevent type 2 diabetes, managing your weight, and we talk about things like portion control. The size of our plates have increased over the last decades. So we have larger plates that we pile up with food. And I don't know about you, but my grandmother used to tell me, I have to sit at this table until I eat all my food. Well, now we know that's probably wasn't, the best thing to do, is to force, children to eat everything on their plate, knowing it was way too much. That's a whole nother different topic. But talking about calorie and carb counting and nutrition education, tips to manage stress, and how you can increase physical activity within the confines of people's environments. Sheila talked about how in rural communities we don't really have sidewalks. We may not have a gym that you can go to, a recreation center. So knowing that you may not have access to physical activity opportunities compared to someone who lives in a more urban or a bigger city, what can you do? So it's about using what you have to accomplish your goal. So we all got YouTube. You can do that in the comfort of your home. You can find a walking program. You can go walk along with the program. I bought like a couple of weights that I have in my house and a weight bench. If I don't want to go out, I can still get in my physical activity right in the comfort of my home. So it's about reducing the barriers and excuses and find out, what do you like to do? I like to dance. So maybe I can put on a Zumba video and do it for like 10 minutes if I don't want to, exercise for 30 minutes on a treadmill. Doing something is always better than doing nothing. And it's about what you enjoy and what you can sustain, because we're talking about lifestyle changes long term. Okay, so the requirements or the eligibility requirements for this particular program: you have to be at least 18 years old. You have to be overweight. For the purposes of this program, if you have a BMI that's higher than 25, they consider you to be overweight. For Asian populations, the BMI tends to be a little bit lower, so it's 23. And you also can qualify that if you have like a clinical diagnosis of prediabetes from your doctor, and that's determined by your A1C or fasting glucose, or there was another glucose test you can have from your doctor to qualify, or you can score at least a 5 on a self risk assessment test, and that's available on the CDC website. And I could probably put a link in the chat box to that as well, so you can take that online. So it just asks you questions. For example, if you are a male, or if are you male or female? If you're male, you get 1 point, because males are at higher risk for developing type 2 diabetes. It'll ask you, do you have hypertension? Because that's a risk factor. So you'll get a point for that. So it asks you about 7 questions. It takes about 5 minutes to complete, and it'll tell you if you're at risk for developing type 2 diabetes. Okay, any questions about type 2 diabetes or the National Diabetes Prevention Program? Nope, I don't hear
Hey, Regina, I actually have a question I'd like to kind of throw out. I think we've got time to our group. It's just to ask if anyone out there is doing anything to address and or identify prediabetes in their community.
That's a great question.
One thing that we do is when we have health fairs, we always have someone here that checks people's glucose or their A1C. But it's been hard to get people to come and do that type of thing more often. We've hit some roadblocks in that regard.
Okay.
What do you think it could be, Christy? Have you had any feedback from folks that may shed light on that?
Well, even they used to give the A1C, now it's just the glucose, and I'm not for sure if it's a money thing, maybe that's what it is.
Mm-hmm.
I'm really not for sure because WVU Extension used to come and give them quite a bit, but they've quit, so I'm not for sure.
Okay. All right. Thank you, Christy.
Sure.
Thank you so much. Anyone else have anything they want to share about activities they're doing in their communities to prevent type 2 diabetes or identify people who may be at risk for developing type 2 diabetes? Nope. Okay. Well, if you have any questions or comments, you can always use the chat box for them. We're going to go ahead and keep rolling. So the next couple of slides, we're going to talk about the Umbrella Hub organization. Marshall University participated in a demonstration project funded by the CDC through the National Association of Chronic Disease Directors. Did I freeze? Uh-oh. One moment here. Am I still moving? Okay.
You're moving, yes.
Okay, I can't see me moving, but I think I'm frozen on that screen. Okay, so the purpose of the demonstration project was to fund organizations who had the capacity to support smaller community-based organizations.
We just lost your screen.
Okay, got it.
There we go.
Okay, great. To provide funding to larger organizations that could support smaller community-based organizations that are implementing the National Diabetes Prevention Program and be able to bill Medicare and other health insurance providers on their behalf. So that's where the idea of the Umbrella Hub organization came from. Traditionally, with the National Diabetes Prevention Program, the CDC put a lot of grant funding out to organizations to train lifestyle coaches to start National Diabetes Prevention programs all over the country. But it wasn't really sustainable because, as we all know, grant funding is not indefinite. It always has an ending point. And there is a long-standing tradition of funding programs, and when the money goes away, the program goes away. So this was an attempt to keep the National Diabetes Prevention Program in communities and support them financially by being able to bill health insurance providers. So the Umbrella Hub at Marshall University, what we were tasked with doing was to develop the infrastructure for the Umbrella Hub, to test the reimbursement and payment models, and to build a sustainable program. And we did that in partnership with coalitions just like yourselves in several different states. So they helped us develop the infrastructure, test the model using their participants in their national diabetes prevention classes, and we're working on sustainability right now. Oh my goodness. Let's see. I'm having technical difficulties. Where are we? I don't know why my laptop is doing this. So let's, okay. Can you all still see my side? Sheila, can
Oh, okay, I can see it now. Yeah, I'm
Okay.
sorry. I was ready to share my screen, but go
No,
ahead.
it's
I'm sorry.
okay. Okay, I'll make sure I'm on the right slide.
Mhm.
Okay, so I'm going to talk a little bit about the business model for the Umbrella Hub. So we always start with the organizations that are implementing the programs, because without those organizations, we wouldn't have an Umbrella Hub. And those would be down here at the bottom. So if you can see the subsidiaries, it'd be the coalitions. Right now, we have 5 coalitions in the Umbrella Hub that they implement the programs. So they implement the programs in their communities. We use a web-based system called Weld, where they input their data, and that system automatically generates claims that we can submit to insurance payers. And right now, we're only submitting claims for Medicare. Eventually, we'll have the capacity to submit claims for various different health insurance providers, for example, Medicaid, MCO, private insurance providers, employers. So we're still a little bit in the infrastructure development phase with billing Medicare. We do assess a 20% admin fee that just helps cover some of the costs for running the Umbrella Hub. So there 80% of the reimbursement goes back to the programs that are implementing, the organizations that are implementing the programs. This out the way. So some of the benefits of joining the Umbrella Hub. You're part of a network. Well, first of all, let me back up. You can join the Umbrella Hub if you're interested in providing the National Diabetes Prevention Program, that 12-month program in your communities. So you would need to have a lifestyle coach, a trained lifestyle coach that's interested in working with you to provide that program. And you would actually apply for recognition through the CDC. Once you do that, then you're ready to join the Umbrella Hub. So so some of the benefits are being a part of a network. All the data is aggregated at the hub level. For organizations that are recognized by the CDC, they typically have to submit data every 6 months. So one of the benefits of joining the hub is that we do your data reports for you. So you don't have to worry about submitting data to the CDC. It's managed at the hub level and submitted on behalf of the hub. So we actually prepare and submit claims on behalf of the subsidiaries. So those organizations don't have to know about billing. They don't have to do anything with claims. They're just entering their data, their participants' weight, and their participants' attendance into Weld, and that automatically generates the claims. They don't have to know anything about billing. They don't have to submit any bills or anything. So the hub handles all the billing. We actually provide TA to organizations that are in the hub and additional support. Sheila and I meet with each subsidiary on a monthly basis. We're trying to reconvene our group sessions because we find value in peer learning. So that's also an opportunity for them to learn from other organizations in the hub. And reimbursement. So it's being able to sustain National Diabetes Prevention programs through the claims reimbursement process. So those are the benefits.
Regina, did you mention that you share CDC recognition status? So for anybody who may have lost their recognition status for whatever reason, COVID kind of, when that hit, a lot of community-based organizations really just couldn't get the program back up and running again. So we heard, and so you guys would have recognition through the CDC by being part of the hub.
Absolutely. And if you're not familiar, they have like a lot of rules and regulations with this program, but in order to continue to keep your program, you have to, reach so many people. There are benchmarks for weight loss for some of your participants. So the more organizations we have in the hub, we have more participants. So that provides a protective factor for everybody in the hub to keep our recognition. Because if you lose your recognition, you're unable to bill for reimbursement. So that's really important. Mm-hmm. Thank you for reminding that. We got to add that to this slide later.
Okay.
And we know that was a lot, but if you have any questions, you can unmute yourself. This is the time we can talk about it. Answer any questions or concerns you may have about, type 2 diabetes in Appalachia, preventing type 2 diabetes through the National Diabetes Prevention Program. Any questions you have about the National Diabetes Prevention Program and offering that in your communities, and possibly joining the Marshall Umbrella Hub. And I'm going to stop sharing. Sorry, because I can't see.
Okay.
I can't see people. Okay, there you go.
Yeah. Any questions, guys?
This may be a dumb question, but I've got one. Is the lifestyle coach a volunteer? How does that come about?
That's a great question, Christy. And that depends on the organization. For most of the coalitions that we work with, lifestyle coaches are volunteers. So they wear many hats. You may have a community member that works at a nonprofit, and they are part of the coalition, and they have a little bit of time they can spend, 2 hours a week facilitating classes. They can be trained to be a lifestyle coach. With other organizations, you may have a health department staff member where it's a part of their job description to be a lifestyle coach and offer so many classes a year. So it depends on the organization.
Okay,
thank
you.
You're welcome.
Thanks.
And Regina, I'll remind you guys, is a master trainer, so she can train lifestyle coaches. If you guys are in need of that. And Renee, I know that you're in Powell County, Kentucky. You work with Stacy, and I remember back right before COVID, I want to say, the Powell County Health Department, if my mind serves me correctly, was interested in part of the Ross work plan, I think, was to get the DPP up and running. And we were trying to coordinate a lifestyle coach training at the time, but unfortunately, COVID hit. And so that changed everybody's priorities. Have you guys gone anywhere with that, Renee, at all?
No, I don't think so. I think after that, they didn't really go back and talk about it much. And I feel like we're just now getting things up and running again. And so that may be something that we decide to look at again in the future. But
Okay.
I came along towards the end of 2020, and I haven't heard them talk much about that since. So
Okay. Yeah, it was just on my brain, and I thought, well, if you're on this call, I was going to pick your brain a little bit and just kind of see if you guys had regrouped or something, in regards to that. But thank you, Renee. Appreciate that. And I see Samantha jumped off, so I was going to ask her. So, any questions? Any other questions, guys? Are you aware of a the lifestyle program, the DPP, anywhere near your neck of the woods, Christy or Renee?
No, actually, we are supposed to refer patients out, and we used to send them to Clark County, I think it was, but they don't currently have anything going right now either. I think everybody's having a hard time getting back to normal.
Yeah, absolutely.
Yeah, same
Absolutely.
here.
Okay. All right.
Well, this may be an opportunity to partner or even thinking about creating your own national DPP. We can help you with that. If you're willing to join the Umbrella Hub, we can train lifestyle coaches. And then the benefit is then if you're part of the hub, you can bill for those you can bill those participants health insurance. For example, with Medicare, the reimbursement for this program, if they meet the performance measures come to class, I think it's $750. So if you have 12 people in your class at $750 and everybody comes to class, that's $9,000. So if you think about what it would cost to sustain a person, Christy, you brought this up. Is this a paid position or a volunteer? It depends on your capacity. So you could eventually make it a paid position and pay the lifestyle coach from the reimbursement.
Okay.
All right, sounds good.
Right. And you guys can feel free to reach out to us anytime, so with questions later. And what we'll also do is share the recording out to everyone. It'll be on our YouTube page. And so share it in your circle, get the word out, and we're happy to provide technical assistance or jump on a Zoom call with you and other folks from your community if you guys are interested in anything that we have presented here today.
I appreciate it.
Oh, we appreciate you all, and thanks for joining us today.
Thank you. Does it sound like something you're interested in, Christy or Renee?
Yes, we will definitely look into it.
Okay.
We've got like exercise programs down here, and at one time, we did a lot with the Diabetes Network. So, that's definitely something that we'll look into.
Great, great.
All right. Well, I really don't have anything else. Regina, Kevin?
Don't have anything else. Thank you for taking the time out to participate.
Thank you all.
All right, bye.
Bye-bye.
Have a good day. Thanks.
Thank you.